Welcome all to the closing plenary of the Not Without FP Forum. We hope we have inspired you all throughout the 2 days. Today, we learned about the power of collaboration and partnership, the need for increased investment in sexual and reproductive health services for youth. We heard case studies of effective contraceptive service delivery in a range of settings and considered the short and long-term human capital effects of COVID-19. We've seen a strong theme of collaboration and innovation in response to the pandemic and far beyond over the last 2 days. Now, please join me in welcoming the Honourable Karina Gould, Minister of International Development for the Government of Canada. Minister Gould is an advocate for women's issues and is passionate about breaking down barriers for women, youth, and underrepresented groups. Also of note, she was the first federal cabinet minister to have a baby while holding office. Welcome, Minister Gould.
Thank you for inviting me here today. Canada is proud to be a part of this incredible community, and I am grateful to the organizers of the International Conference on Family Planning for giving us the opportunity to come together through this virtual forum as we look ahead to November for ICFP 2021 in Pattaya, Thailand. I am pleased on behalf of Canada to share with you our commitment to partnering for access to universal health coverage. That, of course, includes the full range of sexual and reproductive health services and information. We support women taking control of their lives, their bodies, and their futures. But the COVID-19 pandemic is making existing issues more acute across the board. Systems around the world are under incredible strain, and the weaknesses in our systems have been revealed. We are seeing millions of women and girls around the world face severe challenges to their sexual and reproductive health and rights. As medical supply chains are redirected, it is often at the cost of other essential services and supplies. Essential services such as family planning, access to contraception, and access to safe and legal abortion, as well as post-abortion care. Fundamental services that are at the heart of fulfilling our potential. Beyond the disruption of crucial supply chains, evidence shows that rates of domestic violence, sexual and gender-based violence, and early pregnancy have also increased. But another thing COVID-19 has also laid bare is the critical need for the collective effort to achieve universal health coverage. That is why it is so important that this forum has highlighted both the complexities and opportunities presented by the COVID-19 pandemic when it comes to family planning. It has highlighted the need for community resilience, and it has highlighted the need for innovation to ensure that family planning services continue to be delivered to everyone who needs them. So how do we find hope for the future in the middle of a humanitarian crisis like the COVID pandemic? We need to foster the strength and resilience of those systems. We have heard from individuals from around the world underscoring just how essential family planning is, especially in a pandemic. We have seen hard data and eye-opening research on health financing, policy reform, and the power of community-based approaches. We have heard from young people on what is working and what is not. All of these examples show us how crucial it is that family planning and sexual and reproductive health services are made a priority and integrated into universal health coverage schemes. Family planning supplies, as well as comprehensive sexuality education and information about menstrual health and hygiene, are essential. But even if we achieve universal access for SRHR, if people can't exercise their rights, it won't be enough. Canada recognizes the power of women as agents of change through our Feminist International Assistance Policy, a policy that places gender equality and intersectional analysis at the center of Canada's approach to international assistance. Over the past year, our resolve has only increased, seeing the disproportionate impact of the COVID-19 pandemic on women and girls. But challenges go beyond the pandemic, and the health and rights of women and girls are increasingly under threat. Canada is also making efforts to ensure that progress in protecting sexual and reproductive health and rights including bodily autonomy, does not get lost in our COVID-19 response. It is more important than ever to ensure that women and girls have control over their bodies and do not face additional vulnerabilities, discrimination, or violation of their rights. We need to see an integrated effort to better enable our health systems to respond to the pandemic while continuing to address the needs of women and their families. We need to act to protect comprehensive sexual and reproductive health and rights, and that includes access to sexual education and contraception. And we need to partner with organizations and governments in mitigating the worst impacts of the pandemic and its associated lockdowns. Within SRHR, Canada has prioritized advocacy, age-appropriate comprehensive sexuality education, family planning, and a woman's right to choose safe and legal abortion. As part of our government's 10-year commitment to global health, we will spend $700 million annually by 2023-24 on sexual and reproductive health and rights. We know access to SRHR more generally and family planning specifically is critical to advancing gender equality and the empowerment of women and adolescent girls. That is why, as this forum underlines, we must recognize the crucial connection between family planning and universal health coverage. And we must continue working together to ensure that every pregnancy is wanted, every birth is safe, that every girl and woman is treated with dignity and respect and has the right to decide about her body, her life, and her future. Thank you.
Thank you, Minister Gould. Now we'll hear from Acting Administrator for the U.S. Agency for International Development, Gloria Steele, about USAID's commitment to family planning and reproductive health. A career member of the U.S. Senior Executive Service, she most recently served as Senior Deputy Assistant Administrator for Asia, and prior to that was USAID's Mission Director for the Philippines and the Pacific Islands and Senior Deputy Assistant Administrator for the Bureau for Global Health.
Good morning, good afternoon, and good evening to everyone. It is my great honor to join all of you today. I want to start by thanking the Gates Institute and the ICFP for organizing this virtual event. And thank you for energizing the family planning community around women's health and empowerment through the important lens of universal health coverage. The basic premise of universal health coverage is that everyone, everywhere, should be able to access health care they need at a price they can afford. No one should be forced to choose between buying food or buying medicine, or between paying for a doctor versus keeping a roof over one's head. Ensuring that everyone can access affordable health care is critical, regardless of gender, social status, or economic circumstances. Universal health coverage averts financial collapse, prevents poverty, and creates a safer, more equitable world for all of us. In revoking the Protecting Life in Global Health Assistance policy, President Biden signaled his commitment to the empowerment of women and girls. He is committed to promoting the reproductive health and rights, which includes access to voluntary family planning. Girls who can make informed decisions about their lives, decisions to stay in school, delay marriage, and make their own reproductive choices, are often healthier and have healthier families. They are better positioned to take advantage of economic opportunities, and they fully contribute to the social and political fabric of their communities. As the world's largest donor to reproductive health, the United States has a long history in international family planning. Including voluntary family planning services and supplies in universal health coverage is essential to women's economic empowerment and gender equality. It is important that countries recognize family planning as an essential service and that they finance it adequately as an integral part of universal health coverage. USAID's work harnesses both public and private sector resources to deliver family planning and reproductive health services. Through our work, we increase awareness and demand for quality supplies and promote equitable gender norms. Collectively, we must ensure that policies and programs support the needs of women and girls. Programs should be designed to deliver quality reproductive health care, valuable information, and a broad range of contraceptive services and commodities. Family planning advances global progress on the Sustainable Development Goals, empowering women and girls to make informed choices about their reproductive health affects their lives from education to economic opportunities. We assist countries in strengthening their health systems to achieve universal health coverage by 2030 because we believe that voluntary family planning is foundational to long-term development. This is not only smart development, it is the right thing to do. When women are empowered, every one of us benefits. So let me end by once again thanking the Gates Institute and the ICFP for convening this virtual forum. To everyone who participated over the past days, thank you for your commitment to women's health and empowerment. USAID looks forward to working with you as we look ahead to the in-person ICFP meeting in Thailand. Take care and be well.
Thank you, Acting Administrator Steele. We look forward to watching these commitments unfold. Established in 2012, Family Planning 2020 is a global partnership of community leaders, experts, advocates, and implementers working together to empower women and girls and address the most challenging barriers to expanding access to contraceptives. FP 2020 is a co-organizing group member of the ICFP and has announced many of its global commitments from the ICFP stage. FP 2020's Executive Director, Beth Schlachter, is here with us today to share the progress of the FP 2020 movement and to outline their vision for the future in their new iteration in FP 2030. Beth?
Thank you, Dr. Mofokeng. I'm delighted to be here with you all today. Family Planning 2020 was launched with a simple premise that every woman and girl, no matter where she lives, should have the opportunity to use life-saving, life-changing contraception. The leaders who gathered at the London Summit in 2012 agreed on an ambitious goal and a tight timeframe for achieving it, to reach 120 million additional users of modern contraception in the world's 69 lowest income countries by 2020. That initial period, 8-year period, is now drawn to a close. We didn't reach the 120 million, but we did bend the curve of progress upward. The FP 2020 initiative helped strengthen the family planning movement. And along with all of you, there are now more than 130 governments, foundations, multilateral, civil society, and youth-led organizations, and private and corporate sector partners all collaborating to advance rights-based family planning. Dozens of countries have strengthened and expanded their family planning programs over the past 8 years, providing millions of women and girls with access to modern contraception. Together, we've cultivated a global community of practice that is grounded in data and evidence and guided by the principles of human rights. Family planning is a key intervention for countries in reaching universal health coverage, because for women and girls, access to contraception is a fundamental component of primary health care. There is no UHC without FP. That's the story of progress we share in FP 2020's final progress report, The Arc of Progress, which we launched last week. The report is available on the FP 2020 website, and it outlines the impact of the partnership since its inception, shares data and progress over the 12-month period from July 2019 to July 2020, and tells the story of the past year when family planning programs faced their greatest threat yet, the global COVID-19 pandemic, and how partners all over the world continue to work heroically to maintain access to health services. So I'd like to share some highlights with you and look ahead to FP 2030, which we also christened last week. Together, we're building on the best of FP 2020 to craft a new partnership that is smarter, stronger, more inclusive, and built to take us to 2030. So let's start with some of the data measuring the impact of FP 2020. What you see here is a graphic that shows the total number of contraceptive users by year across all of the 69 FP 2020 countries. You can see on the left side of the graphic that in 2012, there were approximately 260 million users of modern contraceptive methods. In each subsequent year, the total number of contraceptive users has grown, and at the midpoint of 2020, we estimate that 320 million women and girls were using modern methods of contraception. Since 2012, the FP 2020 partnership has reached more than 60 million additional women and girls, including 7 million in the last year alone. These gains are almost 30% above the historic trend line, approximately half of our original ambitious goal of 120 million additional users. As of July 2020, there were an estimated 942 million women of reproductive age in the 69 FP 2020 focus countries, compared to 822 million in 2012, an increase of approximately 15 million women each year. Just keeping up with this population growth means that many more women and girls need contraceptive services each year just to maintain contraceptive prevalence. This contraceptive use has an incredible impact on the individual lives of women and girls. And as a result of this contraceptive use, 121 million unintended pregnancies, 21 million unsafe abortions, and 125,000 maternal deaths were prevented in the last year alone. We're also seeing signs of increasing method availability and options for women and girls, from access to a wider range of methods to increasing options for self-care. We're seeing an increase in the financial resources available for family planning, with $1.5 billion in bilateral funding for family planning in 2019 alone. And we're excited about the progress we've made together, but there is still so much work to do. Many of you have been part of the global consultation we've held over the past 2 years, in which we asked you what you want to see for the next phase of the partnership. The mandate from the global family planning community is clear. This partnership will continue. Together, we crafted a vision framework that will underpin all of our work and create a future where women and girls everywhere have the freedom and ability to lead healthy lives, make their own informed decisions about using contraception and having children, and to participate as equals in society. We've spent most of the last year crafting an architecture and governance structure to align with this vision. And after much consideration and consultation with many of you, we're pleased to share that the next partnership will be called FP 2030. We're also grateful for all of the efforts of advocates and government partners have spent mobilizing around the FP 2020 partnership, and we do not want to lose that momentum. While we also want to signal that we're moving forward in a new direction. The start of this new decade and this new chapter for our family planning partnership arrives at a period of dramatic change. If 2020 has proven anything, it's that we cannot continue with business as usual. The pandemic has created and exacerbated challenges, including inequalities and access to contraceptives. It's also demonstrated, though, that there are opportunities we have to do things in new and better ways. The family planning community is and must be a part of the larger reckoning of power and representation in our field. As we enter this new chapter, our partnership will look and function differently and will directly be shaped by the communities closest to the challenges we're trying to solve and those with the lived experience to get us there. To achieve this, we'll look at how we intend to center data, rights, and accountability in the new partnership, addressing issues such as gender and racial equality and inclusion. While the full partnership will officially launch at the in-person International Conference on Family Planning later this year, should the COVID-19 pandemic allow us to do so, we will be transitioning toward this structure throughout 2021, which we're thinking of as a year of transition. I'm excited to introduce now 7 key changes we'll make this year to build FP 2030. They relate to measurement, leadership, reach, structure, accountability, goals, and commitments. So let's start with measurement. While we intend to continue to measure global and country progress, we're working to update the measurement framework for FP 2030 to include, but go beyond, FP 2020's 18 core indicators to additional levels of measurement that we think are critical to monitoring progress in a family planning program. This new measurement framework will allow us to track progress toward voluntary modern contraceptive use by everyone who wants it, achieved through individuals' informed agency and choice, responsive and sustainable systems providing a range of contraceptives, and a supportive policy environment. At the individual level, we'll measure if people have information about methods and side effects for a range of contraceptive choices, and the ability to exercise their right to determine whether, when, and how many children they want to have. We also believe it's critical to monitor progress of the health system, and we aim to measure whether responsive health systems equitably and sustainably provide high-quality services and supplies for a range of contraceptive methods. And third, that countries and partners have supportive policy, financing, and accountability environments that enable voluntary contraceptive use. We're also making changes to how we do our work. The FP 2020 partnership will be led by a governing board with shared decision-making responsibilities. This group will be comprised of civil society partners, advocates, and youth leaders, in addition to commitment-making governments, donors, and multilateral partners. Applications for the governing board will be open in a few months, and we hope that you will consider applying. This information, as well as updates related to the transition, will be posted on our website. As part of this transition, I'll be stepping down as Executive Director of FP 2020 at the midpoint of this year, and we're starting in a few weeks the search for the new Executive Director who will oversee the FP 2030 partnership. We hope you'll consider that as well. Since 2012, FP 2020 partners have supported our 69 focus countries to meet their family planning commitments. Moving forward, we're embracing a more inclusive model by opening the partnership to any country who wishes to participate. Countries are free to join and are encouraged to shape both their commitments and their accountability mechanisms alongside local advocates and experts, including many of you. This will not be a one-size-fits-all approach, so our support will be designed around each country's needs. Already, over 20 countries are poised to make new commitments as they join our FP 2030 partnership. We hope many others will follow in their footsteps. This tailored approach will require support tailored to different contexts. For this reason, we're shifting from a centralized secretariat based in Washington, D.C. to 5 regional hubs that will cover the following regions: East and Southern Africa, Northwest and Central Africa, Asia, Latin America and the Caribbean, and North America and Europe. These hubs will engage directly with the partners and governments in their region. In the coming months, we'll be inviting organizations to apply to host a regional hub, and we'll announce these hubs later this year. Data, rights, and accountability have been the backbone of our partnership, and they will continue to be the foundation for FP 2030. Expanding on the successes and lessons from the last 8 years, the FP 2030 partnership will be even stronger and more inclusive, with a localized structure to increase country ownership and a built-in foundation of rights, equity, and mutual accountability. As we move ahead to FP 2030, we're expanding our aspirations as well. We know that long-term progress will be measured not just in the number of women and girls using contraceptives, but on how we embrace the values that ensure women and girls are able to exercise that right. We're committed to promoting the social and cultural norms that afford women the agency to determine and realize their reproductive intentions. And we're committed to ensuring that all women, regardless of age, income, physical ability, or identity, have reproductive choices and can access quality services designed with their needs in mind. We're also committed to establishing stronger ties with other sectors, like the HIV and broader SRHR, and climate or emergency preparedness and response communities, to ensure family planning programs are resilient and reflective of the realities facing women and girls. This expanded vision will require an expanded partnership committed to ensuring the rights of women and girls are respected and that their voices are heard. We have a lot to build on as a community that will take this partnership forward to 2030. There are also so many relevant opportunities with regard to sexual and reproductive health and primary health care, rights and equity, and development priorities overall. Most importantly, We see rights-based family planning as integral to the universal health coverage mandate of access to high quality and affordable services for all. Additionally, leaving no one behind requires FP 2030 to be even more inclusive in its approach. That is already reflected in a strengthened commitments process that requires the engagement of communities, including adolescents and young people, those who are hardest to reach, LGBTQI and other key populations, to shape policies and programs from the start. By transitioning to a regional hub model, we'll be able to explore those relationships on a much more relevant level, beyond the global to countries and regions, with a staffing model that pulls from local expertise. As of last week, FP 2030 is now welcoming commitments from governments and other partners on a rolling basis throughout 2021, based on country and partner timelines and priorities. Next week, on February 8th, FP 2030 will launch a comprehensive commitments microsite, which contains detailed guidance for governments, donors, civil society, and the private sector. To reflect the importance of a country-led, country-owned process, partner governments are asked to first announce commitments in support of the future partnership at home. FP 2030 is also proposing a robust commitment-making process that strengthens the role of civil society, including equitable partnerships with adolescents and young people, and requires a framework for mutual accountability from the start. Commitments will be highlighted throughout the year, including during global moments like the Generation Equality Forum coming up this summer and the International Family Planning Conference in November 2021, as well as other products, webinars, and convenings that will hold throughout the year. So as we wrap up FP 2020 and begin this transition to the FP 2030 partnership, I'd like to pay tribute to the people who have made this partnership work, to the leaders who had the ambition to call the London Summit, the global experts who volunteered their time to lead FP 2020 working groups, the government ministers who were bold enough to take the plunge into a new era of rights-based family planning, our focal points who have devoted untold time and energy to knitting together new and strengthening existing partnerships, making them work in countries with an eye on reaching everyone who wants and needs family planning services. Young people who stepped forward to inspire us all as leaders and healthcare providers and educators within their communities and among global colleagues. Civil society partners, measurement experts, institutional partners, donors, and so many more from our colleagues in other initiatives across the global family planning sector. And the many colleagues who served on the FP 2020 Secretariat over the years. Because of you, all of you, FP 2020 worked. With your engagement, your dedication, and your partnership, FP 2030 will be even more successful. Thank you. Dr. T, back over to you.
Thank you, Beth. I know that the ICFP community is looking forward to making commitments to the new FP 2030 goals. Jamila Sebares-Clem joins us now to help pay special tribute to our friends and colleagues who have passed since our last ICFP in Kigali, Rwanda. An actor and singer, Jamila has performed in many Broadway shows, including Eliza Hamilton in the Broadway mega hit Hamilton. She's also an activist working to be a voice for the voiceless. She has written an original song for us titled We Have the Power to celebrate and honor our colleagues across the reproductive health community. We welcome you all to share your sentiments with the community as we reflect on the lives of the extraordinary colleagues, partners, and friends who are no longer with us. Welcome, Jamila.
Thank you so much, Dr. T, for your wonderful introduction. And hello to everyone here today from all around the world. My gosh, it's such an honor to be here with you all today and to be able to share this song that I wrote with you. It's called We Have the Power. And I wrote this song as a reminder to myself and to all of us of not only our individual power, but also our collective power and responsibility as a people to change this world for the better, for all people. The chorus goes, we have the power to create a different world when we care for each other and protect one another. And it has been a life's mission of mine through my work, and I know for all of you here today through your work, to create a world where everyone, no matter your ability, your race, class, sexual orientation, gender, or age, that everyone has the ability to receive the education, the support, the care, and the resources that they need to be able to make conscious decisions over their own bodies and over their own lives. And the work that's being done in family planning and reproductive health is absolutely imperative to that change. I know for me, being a woman in 2021, we still have to fight for the autonomy over our own bodies. But I also know that that will not always be the case because of this kind of work, because of people like you and the work that you do and the work that's changing so many lives and empowering so many women around the world, including myself. So this song is also a tribute to you and your work and to the luminaries and the leaders who have gone but who've paved the way. It was also inspired by one of my favorite quotes by Assata Shakur, who said, "It is our duty to fight for freedom. It is our duty to win. We must love and protect one another. We have nothing to lose but our chains."
For There's nothing we can't do. We have the power. We have the power. We have the power. There's nothing we can't do. We have the power. We have the power. We have the power. There's nothing we can't do. Nothing we can't do. Yeah. There's nothing we can't do.
Thank you. Thank you so much. It has been a pleasure to be a part of honoring those who have made contributions, large or small, to the field of family planning and reproductive health, and who have given so passionately to those they serve through their work. I so look forward to seeing you in person in Thailand for the next international conference on family planning. Thank you.
Thank you, Jamila, for such a powerful song to honor those whose shoulders we now stand upon. We now welcome Director of the Bill and Melinda Gates Institute for Population and Reproductive Health, Senior Scientist in the Population, Family and Reproductive Health Department at the Johns Hopkins Bloomberg School of Public Health, and most importantly, the Chair of the International Steering Committee, and if I may say, the heartbeat of ICFP, Jose Oying Rimon.
Thank you, Dr. T. It is my privilege to introduce our next speaker, Michai Veraveja. I know Michai since the 1970s. In my view, he is the embodiment of fearless leadership, creativity, entrepreneurship, and the pursuit for lifting the human condition through public health, microenterprise, and education. He is the founder of his own foundation and the founder of the popular NGO, Population, Community, and Development Association, which happens to be a co-host of this conference. But more popularly known, he is called Mr. Cabbages and Condoms, not just in Thailand, but I think the world over. And why is this the case? Well, early in his career and the beginnings of family planning in Thailand, he thought that the best way to approach family planning was to position family planning as a community norm, as a social norm. In the same way that you see cabbages every day, then you should be able to see condoms. Take the stigma out of it. Kun Michai will take us through the journey of his life, from family planning, microenterprise, HIV/AIDS prevention, and the cheerful revolution in rural education through the Bamboo School. And you will hear about this in a moment. But over and beyond this pioneering work, he is also an entrepreneur at heart. Kun Michai founded a chain of restaurants called Cabbages and Condoms in Thailand. He founded the Birds and the Bees Resort in Pattaya, where there is also a Cabbages and Condoms restaurant. And he has launched Cabbages and Condoms Cafe. So if you are in Thailand and you want some burst of coffee, you can go to Cabbages and Condoms Cafe. That's a plug, Kun Michai. So in fact, it is a privilege to introduce our speaker, Mr. Cabbages and Condoms himself, Kun Michai Veraveja.
Well, thank you very much indeed, Oying, for your kind introduction. And I hope that all of you at the final session will continue your hard work in the areas of family planning and universal health care. I've heard some very, very good suggestions, but I would like to just add and encourage you to continue to do what you're doing and to do more. And I hope you will understand that I am a great believer in family planning, and I believe it's helped me to do many other development activities. So using family planning as a means to reduce understanding of the wrong issues, but also to communicate, to change attitudes and behavior. So I titled my little session with you to say that from family planning to everything else in life. And I've been involved in family planning for about 50 years, and it has given me a great deal of pleasure to work in this area. And the guiding principles in our work in the past 50 years has been, one, to be innovative. Whatever you want to do to change attitudes, behavior, you must be innovative. Two, you have to think outside the box. Don't think inside the box, because the box is always too small. Next is empower the poor, the people you're trying to help. Don't regard them as beneficiaries. Regard them as part of the team that will help change attitudes and behavior. The very, very important issue that I have followed is to take no as a question, because if you come up with new ideas and even not so new ideas, there'll be people who oppose it. Don't take the answer of no as an answer, but use it as a question and to continue your work. And then the other one that's very important is to ensure sustainability. This is not a fly-by-night type of activity. So the first part we began almost 50 years ago was in family planning. In Thailand at the time, there were 7 children per family and the population growth rate of 3.3%. And we knew that urgent attention was needed because this was not sustainable. We could not survive. The families could not survive. The country could not survive with this sort of population growth. So we decided to do something about it. And it took many years before the government was convinced. But eventually they were convinced, and we started on the program. We checked, and the women were very interested to plan their families and wanted to use the pill. However, we had to have doctors to prescribe the pill, and that was very limiting. It was insignificant coverage because we had one doctor per 110,000 women outside the city. So in the villages, in the rural area, only one doctor per 110,000 people. So that was quite inadequate. So the major constraint in the early days was supply, not demand side. In some countries, they think it's demand side, but in our case, it was the supply side. So the first step towards improving the supply side was to get nurses and midwives trained to be able to prescribe the pill. And this is very, very successful because it was a woman-to-woman contact. However, with all nurses and midwives used, we covered only 20% of the villages. What about the other 80%? What to do? So that was our proposal. We came in with a proposal to try to remove the constraint, and we introduced the community-based family planning network in rural Thailand, in communities and in factories. And this is an example of what the community-based family planning volunteer looked like. These were people, mostly women and wives, who were selected by their own villages to say that they trust them, to give them information, to supply them with contraceptives. So they were identified, trained, and the yellow sign in front is above Coca-Cola, is to say the village family planning volunteer, get your pills and condoms here, or consult for IUDs and sterilization at the government clinic and hospitals. So they were able to supply. A local shopkeeper was then able to supply oral contraceptives to everyone who needed in the villages. So that was eventually something that covered the entire nation, and which later became known as the village health volunteer, and who played a very, very important role in containing the spread of COVID-19. So we now have about 1 million of them, but it all began with family planning. And now, after the approval of the government to have some medical supervision, shopkeepers, hairdressers were now able to provide birth control pills. And in a hairdresser, they're all women. So it's a very nice private area for the women to be in. Also in dressmakers. Men don't go to dressmakers, but women do. So under supervision, women supplying pills and condoms were also included as dressmakers. And then in the family planning floating markets, any vendor would also include pills and condoms amongst the fish, the crabs, and the bananas they sold. So it was family planning everywhere. Right? And then that was the supply side. Now the supply side's been solved. What about the demand side? We needed to increase the demand on this to get it going. So the first one was to get a group of people outside the health area to join us. And we were able to train 320,000 rural school teachers over 5 years to understand family planning, to help to be involved in it. And one of the things we used as humor was a condom blowing championship. It brought a lot of laughter and made them relax. And we just said, why would you be embarrassed from a product, from a rubber tree? We should be embarrassed by other things, but not this product. And so they eventually began to get used to it. This is a picture about 46 years ago. And I'm sure that all these men are extremely old by now. So we trained 320,000 teachers to help to spread the message of family planning, because they had parents in the communities, they had their students, and so we could use teachers in family planning as well. And some of them became distributors of the contraceptive by mail, because they were throughout the country. And then after the teachers, the kids in the school, we used a lot of humor. So condom blowing championship was a very, very good way of demonstrating about the issues of family planning. Now, the major contraceptive method used was the pill, but the condom was a major door opener for the whole thing. It desensitized. So you had condom blowing competitions in the schools, in the villages, in the temples, everywhere. And then we also, with the teachers, introduced a new alphabet, whereby, C for condom, I for IUD, P for pregnancy, V for vasectomy, that can be done. And then we introduced the snakes and ladders program, where you throw dice, and if you land on numbers that are anti-family planning, you're penalized and come back. If you on something that's pro, then you move ahead. For instance, mother takes the pill every night, then moves ahead. Then uncle buys the condom, move ahead 5 places. Then uncle gets drunk, doesn't use condom, come back and start again. So those are the things. So basically it was edutainment, education plus entertainment. And kids were much more interested, and even adults, on this. Again, the other issue, humor. Humor is the relay races using condoms with water inside. The kids were very keen. And so this desensitized the whole issue of the condom. Then it was time for the men. The government asked the Ministry of Health to help to promote vasectomy with men. So we got the visitors, the distributors to talk to the wives of the men and asked them to bring them for discussions. And then they recruited them, and then the mobile van would go to different places and to provide vasectomies. So this produced a system whereby that there was no fear, because they feared hospitals. A lot of people fear hospitals, but not in a van. So that was done. And then we introduced in humor events, such as the Millionaire Vasectomy Festival. This was done at the Lottery Bureau. And if you had your vasectomy, you were given 1 lottery ticket. And if you win, you get $1 million. If you don't win, you're like everybody else. But here is a group of 52 doctors, the best doctors in the country, to provide vasectomy using luncheon tables, to show them as a very, very simple procedure, not a hospital. Again, this is to simplify, to desensitize. And again, we use many issues for vasectomy. This is a vasectomy on many days. In particular, this is on Father's Day. So Father's Day Vasectomy Festival, you bring your father for vasectomy by children, say that it'll give you a better life and bigger inheritance. Again, a bit of humor and a bit of reality, and to let them show that is a very normal thing. You don't have to go to hospitals on it. We all then had a small bus line called Vasectomy Tour, and you paid a small fee. It was one of the first few air-conditioned buses. You could get on it free if you had your vasectomy with a ticket. Otherwise, you pay something. But again, this moved around the city. It gave transportation, but it also gave messages out to the people. And then finally, in the family planning program, we just said that we need to go on to development. So this was the beginning of our microcredit loan fund for income generation. It was initially for the non-pregnant women. So it was decided by the women, run by the women, that the first microcredit fund would only be available for women who practice family planning. So this is an example of doing it. And today it continues, but it doesn't have to be related to fertility anymore. It's just now what we call a village development bank, that you can improve your quality of life and increase income by joining it. But it all began with family planning. And as a result of all of this, between 1970 and 2015, the number of children per family came down from 7 to 1.5, and the population growth rate of 3.3% to 0.4%. So we succeeded in getting that done, but that was not the end of the line, because in the late 1980s, life in Thailand was interrupted by the spread of HIV. And so we started joining HIV, the fight against HIV/AIDS. And I think you will see that our experience in family planning, in particular with the condom, was a major instrument in fighting AIDS. And of course, the dare and the humor was also introduced. So it was estimated that between 1990 and 2000, Thailand could have between 2 and 4 million infections if nothing was done. And we told this to the government. However, denial was the order of the day, while thousands were being infected. So this was statement: no AIDS-related news permitted on radio and television by the order of the Minister of Public Information and Broadcasting. And the Ministry of Public Health remained silent. So we could easily surrender to the government's decision or say no to the issue and take no as a question. So we decided to find a new ally and ask the military for some help. So here I am sitting with the Commander-in-Chief of the Armed Forces and asked him for help to provide education for people through 300 radio stations and 2 television stations belonging to the military, and he agreed. Then soon after that, we had a new prime minister. He's regarded as probably the best prime minister Thailand has ever had. After years of denial, he came in and he agreed to be the chairman of National AIDS Fight Endeavor and helping to get every sector of society to get improved, get involved in it. And I was asked to be a member of the cabinet. And so here is the prime minister using a sticker on AIDS, was put everywhere. So it showed very clearly the prime minister supported it. It was not just the Ministry of Health. And this high-level committee saw a 50-fold increase in government budget with the new prime minister. So now the fight was really on and funded. Then we brought in the radio and TV announcers to be trained. I was in charge of this and made it compulsory for 30-minute HIV/AIDS educational spot during every hour of broadcast in 488 radio stations and 6 TV networks. And we gave them half a minute extra for advertising. So it was a win-win situation for everyone. And then we provided training at Government House for all senior government officials, governors, police, others, judges also, to understand and to be involved. We said, this is a fight for everybody, not just for doctors. So the public education was moved from the Ministry of Health, which is a very small unit, into the office of the Ministry of the Prime Minister's office, and I was in charge of that. And so we used the office of the Prime Minister to be the major person or group to spread the understanding of HIV/AIDS. Then we brought in producers, actors, directors, and got them involved and brought in people living with HIV to meet them, to let them be involved in life. Then our experience in family planning helped pave the way for the fight against AIDS. This has been a very, very important issue. Next, we went to the students, but starting off at the universities, we got university students to agree, to understand, and to agree to be trained and to go back to their old secondary schools and help to train their younger brothers and sisters on understanding of AIDS, and then got the secondary students to help train primary school students. Here was a network of education institutions which are normally not used at all. So schools can be used as a major instrument of change. And we also introduced the sex education van. From a distance, you see it as sex van. The word education was small, was to go to all schools to give it AIDS education to students. And we had on the side all the messages. So this was mobile. It would go to schools all over the place. And then there was special training as part of the program with the mobile van, was to show that life without sex education is like walking blindfolded. We just let them understand it, as everyone must understand the issue of sex education. Then AIDS training for teachers. Again, we've already worked with them in family planning, so it's easy to bring them back into the fall to help them on AIDS education. Then the students who were trained by the university students, secondary school students, started training by the secondary school students for the other secondary school and primary school students. And this was funded by the business community through our effort to convince them. Then this is part of the fight against AIDS, education, sex education, on the realities of reproductive health. And also never be shy. Use a condom a day to show that how to put on a condom. And again, it brought in a lot of laughter. And we also said that the condom can be used for many more things, as a decoration for your hair or a hairband. In other words, there's so much that can be done with it. And then not only that alone, we said that we could use the condom to polish a schoolgirl's shoes. And it made it very, very shiny. Again, it just showed that why should you be embarrassed by the condom? Again, we had camps for youth, a very strong program funded by the government for youth. And then finally onto the education system, down to the bottom scan, and is the primary school, where all children in primary school were given a card on AIDS, we call it AIDS safety tip, and a condom inside, and they would give it to every household in their village. So this was a real nationwide against AIDS, and everyone was involved. You can see that it's not just the doctors or nurses, but everybody else. And then we also did it went to the factories and companies to say that you need to train your staff, because sick staff can't work and dead customers don't buy. So they were involved in it and training. We provided information for them for the training of their staff. And these were the AIDS safety tips, printed in Thai and English, paid for by companies, was given out everywhere. Again, we got many, many companies to do it. For instance, all banks gave it to their customers, insurance companies, and gave it to us to give out to the public. And then making everything work more, we went to the entertainment district. We had our Captain Condom, like Superman, and he was a Harvard MBA. So he went around to the schools and to the entertainment area to introduce the issue of family planning and HIV/AIDS, and this in a night entertainment area. And then condoms available everywhere, for instance, in all shopping centers, in banks, in offices, on trains and buses, in bars. So it was condoms everywhere in our war against AIDS, at toll booths, at bus stops, in the streets, and also AIDS information condoms in taxis. So you could see that this is really 100% condom program. Then finally, in terms of AIDS, we got the police to be involved, giving out condoms in traffic, and we call it our Cops and Rubbers program. As you can see, we use a little bit of humor in our work. We also introduced a chain of restaurants for cabbages and condoms, where information on HIV/AIDS was given out. Every customer was given a condom decoration in the restaurant, and people who came and ate there realized the need to understand HIV/AIDS to help spread the information. And the profits were used for activities in communities to further AIDS and education and rural development. And there's a picture of Mona Lisa holding a condom in the bottom right-hand photo. And this is, we have a sign, we said, sorry, we have no mints, please take a condom instead. So we had several sizes. We have military size, politician size, coup d'etat size, democracy size. Again, making available and humor. And we also, around Christmas time, we have a condom Christmas tree, and we have a Santa Claus dress in condoms. Not only did we do these things, we also went to everywhere else and helped to establish citizen youth assemblies funded by the business community in the different areas for the youth to come out and fight, because they are going to be the group most affected, the generation most affected by HIV/AIDS. So we also introduced the positive partnership, which is economic empowerment as a means to reduce stigma and discrimination for people living with HIV/AIDS, because there was a lot of discrimination going on, and people who were infected had a miserable life, and we felt that we needed to improve it. So we introduced what we call positive partnership, whereby a person living with HIV selected a buddy, a partner, to work with them to help doing business together. We provided a loan fund, but the person who was negative was required to provide information to other people to reduce stigma, but to improve understanding, and also to encourage the person living with HIV/AIDS to move on with life. So HIV positive person, HIV negative business partner, we provided a loan fund to do business. And this is an eye-opener trip for HIV positive people to go and see what business opportunities there were. And this is making a shampoo and soap, learning about tree nursery and vegetables, skills training on business, on simple accounting. Some examples of business activities. For instance, here's a woman in red and the young boy in white, who is the son of the person infected, the other person in white, and they did a laundry service together. This reduced stigma a lot in the area. And here's a fruit vendor between brother and sister selling vegetables and fruit. Here's a couple. They met. One was positive and the other one was not, and to work to do business together. And later on, they got married, and of course, they used condoms. Motorcycle repair, shopkeeping and selling of gifts, buying of used items, bottles, plastic containers, and so on. And here's a small printing press, batik making, repairing of electrical appliances, television. And this is a very, very important one, that the woman is now allowed or invited to make food, cook food, and sell to students in the secondary school. Prior to this, she was required to walk on the other side of the street from the school fence for fear of getting infected. But after understanding and explaining, took a lot of time, it was all understood, and she became a seller of food in the school. And of course, to keep up with our move, we had our coffee and condom stalls by people living with HIV. So you can buy a condom, you can buy a coffee and get a condom free. So basically, we're providing that the project, the Positive Partnership Project, has shown us that the economic opportunities have been given to them to provide gainful employment, dignity, and new reasons to live. Their lives are now meaningful and filled with hope. And of course, soon after this, the drug came in, and most of them are still alive and doing extremely well. And this was reported by UNAIDS as a best practice in the Positive Partnership. It's available for free download. Then you can see that between 1991 and 2000, that because of all the effort was done by everyone, new HIV infections declined by 90%, according to UNAIDS. On the other side, according to the World Bank, 7,700,000 people had been prevented from being infected. Can you imagine the harm that would have been done had we left it aside and listened to the government? So this was a very good example of taking no as a question. And so later on, this new Prime Minister also joined in, and here he is wearing a condom hat. And of course, this is our most famous picture, is Bill Gates Sr. visiting us in Thailand. And you can see that he's wearing this cap made of condoms with a Nike swoosh. So in other words, our work continues and everyone helped us. We're immensely grateful for this support. And so that Olympic is supposed to be coming up soon. Why don't we also use the condom as a symbol of hope? So let the next Olympic save some lives as well. Then our final move, we asked the question, can schools play a significant role in accelerating social and economic advancement in rural communities? And the answer was that we said yes. So we established a school, the Bamboo School. Our move was a cheerful revolution in rural development. All our work in family planning and HIV/AIDS has been a sort of a cheerful revolution because we've always added laughter and humor to our work. So we established this school as a gateway for social and economic advancement in surrounding communities, not just the school itself, but all the communities surrounding the school. At this school, students learn life skills and occupational skills and are trained to encourage and trained to be change makers and social entrepreneurs while becoming active in the management and administration of the school. This is a school where students help to run the school. For instance, here's a student government. They are presenting activities to school to the deputy prime ministers and all the cabinet ministers who visit the school. They're checking the food at the local market because all purchasing is done by students. Even these vehicles given to us by IKEA to help our work, again, bought by students. Any student wanting to come to Thailand, to the school, from Thailand, Laos, Cambodia, Vietnam, are interviewed by older students. So students help to interview and select incoming students. They also interview and help to select incoming teachers as well as evaluate them. And school fees is not paid in cash, but paid in by performing 800 hours of community service per year and planting 800 trees. So in other words, the community service time can be used to help spread the message on HIV/AIDS, on healthcare, on many other things. So here's getting people not only to come to school, but to come to school and do good things in society. And here is a group planting trees in lieu of their school fees. And here in the school, we concentrate very much on trying to keep people in their rural communities in the long term. And we're using this vegetable growing colorful, using little land, little water, and little labor, mostly for people who are elderly, who are living with disabilities. So this is an area. And here is using on land that cannot grow anything, on cement, on rocks, we use PVC basket to grow vegetables, including the hydroponic as a social enterprise farm at the school. And so these are some student-operated businesses from the microcredit loan fund, again, from the family planning days, so that they would learn how to do business, and when they're home, they can stay home and earn income together with their family without having to migrate. So here's an example. We select something that uses little land, little water, little labor with high income. And this is a mushroom farm, introducing it to the students, and then outside. It gave a profit of 200%. And then on bean sprouts, 250% in 4 days. This is extremely important for the people in the community who are living with disabilities and some who are bedridden. And these are the other activities, selling food, and 30% of all their profits go to help the community service. And so that paying their school fees, serving the community, an example is teaching dental hygiene, health, and sex education to primary school students by secondary school students. And here's dental hygiene training for young students in schools. Also, sex education for primary school kids is a very good way to start We ask them when you were born. Everyone knows what month they were born. And then we ask, what month were you made? And then they have to go back 9 months. But we give them a new way by adding 3. By adding 3 to the month of your birth, you will know when you were made. And then student initiatives to improve food and income security for the elderly. The government would like to see a lot done for the elderly, but the capacity of the government is very, very limited. And the imagination is still somewhat lacking. So we use students to work with the elderly people. Again, this is part of healthcare and security and food. So training for the elderly in vegetable growing so that they will have security in food and income. So here they come into the school for training. And we also help to establish a vegetable farm in the villages for the elderly, whereby they can work. Here's growing vegetable baskets where you don't have to bend down. For elderly people, this is very important. Here they are now selling bean sprouts to the schools. So now they have a lot to do with income to earn, and they are extremely happy. Then we believe that every school in the world can be used as a happiness center for the elderly. Bring the elderly to the school to be with the students, to do farming of vegetables together and so on. So that from our own villages around our school, we were asked to help other schools, and this was funded by the business community. And this school was established with the funding that received $1 million from the Gates Foundation for the Gates Award for Global Health. We're immensely grateful for this, so that money from Gates was used to start a new revolution in the school. And now we're going out to help other schools. With the help of the private sector, we're now covering about 100 schools, whereby we help them to have income generation activities, healthcare, and so that they can stay in the villages in the long term and help raise income. Here's the vegetable plot where the families have come in to help the school. So the students are now learning new skills to grow vegetable and earn income. There's a loan fund for the students as well as a loan fund for the community. And here the farms, the vegetables grown by the students, extremely successful. And the parents and grandparents can also borrow from the fund to earn income. So this is the beginning of trying to provide source of income and food security for elderly people. And after all of this, the Bamboo School has been regarded by the United Nations, the UNFPA, as one of the world's most innovative schools. And of course, we're immensely grateful for this recognition. So I think you can see that it all began with family planning. And today we believe that you can use the school to implement all areas of UN Sustainable Development Goals in every area. So I hope you will agree with me that if I say that let's become real change makers and promote family planning as a vital element of universal health care. So I would like to thank you very much for the time you're spending with me and the honor given to address you. And I hope that I'll be able to help you in any way you would like. Please contact me. Thank you.
Thank you, Kun Michai, for such an inspirational, pioneering, revolutionary work. We can't wait, to visit you soon, we hope.
Good. We hope so, yes.
Yeah. I am delighted for this role of introducing Lea Salonga. I was privileged to know Lea early in her teenage years. That dates me. Lea Salonga is a multi-awarded international actor and singer. She won the Tony Award for her performance on Miss Saigon here in the US. She also won the prestigious Sir Lawrence Olivier Award in the United Kingdom for the same performance, Miss Saigon, including the awards given by Drama Desk, Outer Critics Circle, Theatre World Awards. She's the first Asian to perform the role of Eponine and Fantine and the classic Les Miserables. But beyond her being a Broadway star, so to speak, she was the voice of Princess Jasmine in Aladdin, the movie, and of Mulan in the movie Mulan. She was honored by Disney as a Disney legend. What a privilege to have a Disney legend in family planning conference. But not many of you know that in her teenage years, Leia was already a champion of reproductive health. She was the star of the program by the Foundation for Adolescent Development in the Philippines to reduce teenage pregnancy. And at the time, she performed with a superstar group which was famous worldwide, especially in Latin America, the Menudo Group, both live as well as in music videos, promoting sexual responsibility. And you know who was in that Menudo group, as I recall? Only one of the several boys in that group. It was Ricky Martin. But look where Ricky Martin is now. That teenage pregnancy reduction initiative was followed by Leia being active in another really out-of-the-box program at the time, which was called Dial a Friend, in which teenagers can call a telephone counseling hotline and get confidential counseling on a variety of issues. Continuing her support for reproductive health issues, despite her many schedules around the world, Leia found time to join community actions in the Philippines to support the passing of the reproductive health law, which was mired in the legislation for 14 years. It finally passed several years ago. So Leia and her team is joining us in this virtual conference with a powerful rendition of an original song that was composed precisely for this event. Stronger Than You Know. I think it also addresses our theme that we are all in this together, family planning and universal healthcare. We will be stronger all together. It is indeed a privilege to introduce Leia Salonga.
Thank you, Oying, for that lovely introduction. Please extend my warmest regards to all of my friends and colleagues at the Bloomberg School of Public Health at Johns Hopkins University. And thank you for bringing back to mind my early work with Menudo and for my involvement with the Dial a Friend telephone hotline. It was such an inspiring opportunity working with you so many years ago. And I'm so pleased to be with you today to join this international community of advocates, youth leaders, researchers, policymakers, and more for this important convening. Access to family planning and reproductive health services are essential, especially as we move forward towards a second year of living in a pandemic. You have come together today as a community to continue to advocate for family planning as an essential part of universal health coverage, to get contraception to those who want it in the face of supply chain disruptions and shutdowns, and to fight for reproductive health and rights. The past year has presented many challenges, but we've learned that we are more resilient than we know and stronger than we imagined. Thank you to everyone making SRHR care during the pandemic a reality. This song is dedicated to you.
Girl, on your darkest day, when you feel lonely and afraid, surrounded by the night, you know I've been there before, a million miles from the shore, searching for the light. When the water is rising, the waves crashing in, and you're hoping for somewhere to go. See the night sky shining, reminding you deep in your soul. Girl, you are not on your own. There are stars in the darkness, calling out to you, constellations to guide you. And I know in this moment you're feeling all kinds of alone, but you are stronger than you know. Stronger than you know. In the heart of a hurricane, there's a courage you can claim if you hold on tight. The storm that you're moving through, it becomes a part of you and helps you shine your light. With the turning tide and the stars as your guide, you will find your own way. Well, the darker the night, the brighter you make a new day. Girl, you are not on your own. Souls you never knew are reaching out to you as we stand upon the shoreline. Here on solid ground, we'll keep you safe and sound. I see you through the sunshine. Welcome home. Girl, you are not on your own. There are stars in the darkness, calling out to you, constellations to guide you. And I know in this moment you're feeling all kinds of alone, but you are stronger than you know. Constellations to guide you. And I know in this moment you're feeling all kinds of alone, but you are stronger than you know. You are stronger. You are stronger than you know.
We are indeed all stronger than we know. Thank you, Leah, for such a message and for joining us today and for standing shoulder to shoulder with us on women empowerment and reproductive health issues. These 2 days have been inspirational to me, and I hope you feel the same way. Thank you to all the speakers, our panelists, the participants, the active members of our International Steering Committee, the National Steering Committee, the core organizing group, and of course, the Secretariat. All of us have collectively made this event possible. Oftentimes, it is in these times of crisis where many ideas are churned, where we turn good ideas into great ideas. where we are inspired by many or singular moments of lift that we may have heard in the last 2 days. I hope so. And where mindset change can create the breakthroughs that we need, even beyond our imagination. As soon as COVID allows, I hope to see you all in Thailand. We will make an official announcement on this in the next few weeks. As you know, our number one priority is always the safety of all our participants, followed, of course, by the desire that all of those who wants to come to the conference are able to come wherever they come from to meet champions in reproductive health from 120 countries around the world. So again, hopefully see you in Thailand soon.
Thank you, Oying. Be the first to hear about the final date of the next ICFP by signing up for email alerts for up to the minute conference information here on the ICFP homepage. A huge thank you to our co-hosts, the Kingdom of Thailand, the Royal Thai College of Obstetricians and Gynecologists, and the Population and Community Development Association, and all of those on the co-organizing group, the Secretariat, and national and international steering committees, whose subcommittees helped to plan and execute this inspirational event that has brought all areas of our community together to share ideas, best practices, and solutions, and celebrate what we have accomplished and chart the course towards the future of family planning. And last but certainly not least, we would like to thank our incredible sponsors and partners, without which the ICFP would not be possible. If you did not have the chance to visit the virtual exhibition area on the website, please do so. These web pages will be up on the ICFP website through to our next in-person ICFP. We look forward to continuing to engage with you through future ICFP community actions as we prepare to come together at the in-person conference in Thailand. We hope to see you there.
Power to be seen across the world. We not the future, we the present. Invest in us and you will see the world is changing. Because our bodies and the future we hold it. We want for you to see that everybody can win. Could it be education or contraception? Everyone will always be here to sing. We are family and we are planning to go around the world telling everyone that we demand a voice. We are family and we are planning to go around the world telling everyone that we demand a choice. We on the ground in every area. We're the ones to make a world a better place. We want the best, we want the way. There's something for a future so bright. Because our bodies, and the future we holding. We want for you to see that everybody can win. Could it be education or contraception? Cause the boys we always be fine. We are family and we are planning to go around the world telling everyone that we demand a voice. We are family and we are planning to go around the world telling everyone that we demand a choice.
We gon' climb up and then rise up. Won't keep our eyes shut, we ain't got enough. I know you tired of seeing things the same way, but in time you realize that things change. We the demographic dividend. You see the work that we putting in. I'ma stay true to me and use my opportunity to show you how to build a community with unity.
உன் வாழ்வு உந்தன் கையில், எதிர்காலம் உன் கண் முன்னில். மனதையும் உடலையும் பாதுகாப்பாய். வேண்டும் வேண்டாம் என்று சொல்ல உனக்கு மட்டும் உரிமை உண்டு. தேவையில்லா குழப்பம் நீக்க வெவ்வேறு பல வழிகளும் உண்டு. உதவக்கரங்கள் உண்டு, முன் வந்து சொல்வாய் இன்று. உதவக்கரங்கள் உண்டு, நீ முன் வந்து சொல்வாய் இன்று. இன்றே முடிவு செய், உடல் நலத்தை உயர்த்தி வை. இன்றே முடிவு செய், உடல் நலத்தை நீயும் உயர்த்தி வை. Because our bodies and the future we hold. We want for you to see that everybody can win. Could it be education or contraception? Girls and boys will